Okay, hello, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. I just want to demonstrate your type 2 slap lesion. We're going to take a gold instrument that is actually called a crochet hook. I'm going to use it as a probe. We use the hook on this to move sutures around. You'll see that in action in a little bit. But right out of the gate, I just wanted to show you the biceps tendon, which is running up here. As I tug on it, we can get a sense here that this is loose. And we can see how this peels away from the bone all the way back here. So that is what we're calling abnormal, especially in a young shoulder like you have. You can see how that's all pulled away from the bone. Okay, so that's what we call a type 2 slap lesion. Okay, now could we just do an injection and hope that heals back to the bone? Maybe, but what seems to work the best surgically is to remove this cartilage so that we can get this to heal back to a bony surface, since it typically won't heal while it's still this unstable. You can see that every time you move your shoulder, it's doing that. There's no reason why it would just stay in one place and be stable. So the next step for us is to take a shaver. Hold that camera for a minute here. And our shaver is going to come in down below right here. And now with the shaver, we're going to slip right in front of the bicep. See how that just slides down? That's another way we know this is abnormal. We shouldn't really be able to just slip down in front of the superior labral tissue here. Okay, hold this real still right here. And I'm going to start the shaver and turn on a little bit of suction. And this removes the cartilage. On the superior glenoid, the cartilage comes over the superior rim, and that's the cartilage that we're removing now so that we can have a nice bony surface to repair this superior labrum and biceps anchor back to. So this device just spins. Let me pull back slowly and show you. So see how that just spins and it has suction attached to it. Push in a little bit, yeah. And so we keep doing this until we can see kind of the yellowish bone, the subchondral bone exposed. We're almost there. We'll keep working here, show you some more in a minute. Okay, so I'm going to show you one of our endpoints, how we know we're done debriding. We can see down in there, see the bone, see the yellow bone there? That's what we're trying to do, because the tissue won't heal back to that white stuff. It's got to heal back to at least a little bit of the yellow bone, at least in my experience. So that's what we're trying to expose here to get the best surgical outcome. So once we expose enough of that, then we'll go ahead and place a suture anchor in and show you how that works in just a minute. Okay, so now the next step is to make a hole in the bone for the anchor. I like coming behind the biceps tendon because that gives me a nice angle down the length of the glenoid here. So we're going to make a hole into the, see if I can show you where we're at here. Basically right in the base of that bony defect that we made. See the bone? Hold the camera here. Let me see the crochet hook. Hold it real still right there. Just like that. Crochet hook? Yep. So you can see how we're going to go right into the base of that defect here. Here you go. We'll take the drill. And after drilling that hole, we will take our anchor and tap that down into the bone right there. We'll pull back, and you can see now that leaves us two different colored sutures. That feels very solid, just like that. And so now the next step for me is to take 3 of these sutures out of the way. So I'm going to reach in here. Okay. And we'll take a switching stick. And we're going to slide those 3 sutures outside the cannula, just like that. Okay, very good. And now those sutures are out of the way. We'll go ahead and take the one suture that we're going to work with first. We're going to take a straight crescent suture hook with a shuttle relay in just a minute, so we'll get that ready to go. So there's the one suture inside the cannula. And in just a minute, we're going to pass a suture hook. The suture hook's going to come down in this path. We're going to pass a stitch across right here in this region of the superior labrum. Okay, so here's the suture hook. You can see it's kind of got a diamond point on it. It's loaded with a black wire that we call a super shuttle. Trying to hold the camera there real still. See if we can make sure. We always want to make sure it feeds, which it's not doing. So let me start that part over. There we go. So there's the wire coming through. Now we pull it back so you can see it's just at the edge. And then now we're going to rehearse our stitch. So we'd like to bring this suture basically back through this region. There it is coming underneath. We'll feed that through. Okay. Okay, so with this grasper, we just grab the relay here and we're going to pull it out. We're going to load it with that blue suture that you see. I got you. Here you go. And so this relay, I haven't really shown it to you, but it's got some holes in it. You'll see that in just a minute. That allows us to move suture back and forth. So as we pull slowly, you'll see how it brings it, see that hole there? So that's going to bring that underneath and back over here. And then as we pull tight, that suture goes all the way underneath. Here you go. So now the next step, go ahead and load it up again. The next step is to get the rest of the sutures lined up. We're going to reach in here and get the partner suture like that. Hold the camera there. So now that suture is going to be tied over here. We're going to make a very similar type of stitch on the other side of the biceps tendon. And so in order to do that, we're going to pull this suture out and then position it inside this gray cannula on the right. Okay? And so now before we pass that one though, we're going to go ahead and tie this one right here. Okay, so the trick with these slap repairs, in my experience, is to not over-tighten them. So we've got this suture tied. I'm going to pull this out here. And that's going to hold it down. We've got the other suture tied. That's basically going across the anterior labrum here. And now that's going to act like a pair of suspenders holding that down until it heals. So we're going to take things a little bit slowly at the beginning. As we look down the front of the shoulder, we can see the rest of the anatomy here looks good. It's the middle glenohumeral ligament here, crossing. This is the anterior or superior edge of the subscapularis tendon here. Here's the anterior labrum. As we come across, the posterior labrum would be back over here. Okay, so that looks good. Maybe a little bit of fraying, but that's just almost microscopic in nature. Posterior capsule. And then we can look up at the undersurface of the rotator cuff here. And this looks normal, which is what we expected to see. So we're going to finish up here. Here's the rotator cable. We're going to finish up here and get you back to the recovery room shortly. And hopefully just these 2 sutures will hold this down and give it a chance to heal in position, okay? Good luck to you now. Bye-bye.